Hello, everyone. And Kitabe Club is back with another beautiful live. And today we have with us author Bornali Datta for her book In a Better Place. So, Bornali Datta is a pulmonologist and a public health advocate. And she has worked in some of the busiest hospitals in Delhi and Yorkshire. And she now lives in Delhi. And let's welcome her. Hi, Bornali. Hi, Bornali.
Hi, Neha.
A very warm welcome to Kitabe Club Live,
Thank you very much. Thank you for having me here.
and congratulations on your debut book.
Thank you. Thank you.
So, I was telling our viewers that you're a medical practitioner. So, how, from a medical practitioner, you decided to author a book?
Yeah, that's a very relevant question. I've been asked that by others who've kind of seen the book. So I think there are two things to this. One is that an inherent love of books and reading. So in the era that we grew up, all we had was books, and I think all of us just had there was no digital, there was nothing. So we lived our lives, a parallel life through books. So that I think always had a very great impact on me. And the second thing is the fact that I think our lives, the doctors' lives, experiences are all very, very unique, very, very kind of interesting, fascinating in different ways. And not enough is written about it at all, for good reasons, because the doctors, simply don't have the time and, the inclination to do so. But I just always feel that, the life that we see around us in day-to-day life, and you come into a hospital, and while nobody likes going to a hospital, but the experiences you have, they're all very intensified. And there are so many human stories which unfold all the time in hospitals, and that is something I always feel is something that everybody, I wanted to put it out there, the doctor's perspective, and not just the doctor, the patients, what they go through, what life is like within the walls of a hospital. And in a not in a very sad way, not in a sad or depressing way, but just in a somewhat real, somewhat light-hearted kind of manner that everybody can read and maybe identify with and understand. So that, I think, is what made me want to do this.
Yeah. So, you know, when I started reading the book, the first chapter itself was so heart touching. It was, and I felt I resonated with it because recently I've had such experiences in my family where a lot of my close family members were admitted to the hospital, and we were like continuously for a month we were in that process of hospital, कोई emergency में hospitalized हो रहा है and all that. So it was, when I read that, I felt like, okay, this book is for me. I want to read it, and
Right.
reading about other people's experiences, and then it was that kind of a thing for me. So while you decided that okay, this I am going to write a book, what was your family's reaction? Did you tell your family beforehand, or did you start the process and then you spoke to your family about it?
Yeah, so I think when I first started writing it, I don't think even I knew that I was writing it as a book, Sometimes you just want to, like, some things just come out of you, right? So it was a bit like that. And the first draft I, in fact, wrote, a decade ago. So, like 12 years ago almost, when I had come back. And I had a 6-month break before I started work in India. And there were things in my mind, just experiences that were there, things I had jotted down, and I was still trying to form it in my mind, and I was just like writing it as I went, just so that I could kind of document it somewhere, record it somewhere. And I don't think at that time it had even formed into a sort of a book at that early on. And then much later I tried to find a way to for it to be a narrative, for it to be like in the form of a book that could be read. And that took a, let's say, you can see it took such a long time, because that's what happens. So I think when I wrote that first draft, I don't think my family, because I didn't intend it even at that time to be a book as such. So I don't think I knew. But obviously, as time went on and I thought more about it, and I really wanted to. And then, of course, you have a lot of doubt about whether it's even worth, is it really something that would anyone even want to read about? And that is there, of course, because these are hospitals, doctors, patients are, often not what everybody would want to read about. You'd want to read about things which are not not too much reality. You'd rather have things which are a bit, lighthearted, that keep you in a good spirit. And so I wasn't sure for a long time. And then, well, once my so two key people, one is my sister, who's a doctor herself, and she's written a book as well, and one is my husband, who's obviously, a very close kind of partner in all these experiences and things. And I think he shared my doubts and hesitation, but equally gave me a lot of suggestions and advice and things, as did many of my friends. A lot of them are obviously doctors as well, and I really sort of sought their opinions and advice early on, when it was a very early draft, and to understand, is it something, is it worth it? And so I think, yes, I think I was certainly encouraged by responses by family and friends.
That's wonderful, and it's totally understandable for a doctor to take such a long time to write, because obviously you have a super busy life, and probably we cannot even comprehend the kind of pressure or the stress that doctors have in their lives. So yeah, that's really commendable that you came up with this book.
Thank you.
So while you were writing the book, what kind of difficulties did you face? So, like, not from a research point of view, because it's a book about doctors and you know that in and out, you face it every day. So, not from that point of view, but otherwise, were there any difficulties that you faced?
Yeah, definitely. So I think the first thing is this, lack of not just time, mind space. You need to have a really kind of blank mind, so to say, to be able to immerse yourself in the story. And I think once I'd done that first very initial draft, I don't think I got time at all. I got completely started work here and got completely consumed by work, medicine, etc. And I'd take it out every now and again, tinker it with it a little bit and put it back again, and it just, like, I just couldn't get to that point where I could sit and complete it. So I think time is a big thing, inclination, mind space. And then finally I think got a chance to complete it because I was away for a spell supporting my daughter through college. I was in UK, in fact, for a spell, and I wasn't working. And that time I just realized that I could actually get into it and tie up all the loose ends and flesh out the characters more, and things like that. So the first draft, when I did approach the publishers and the external reviewer, didn't give me very good comments at all. It was quite sort of, I just thought maybe it is actually not good. But subsequently I got that 3-4 months to sit and work on it. So I think that's, you need to come out of your normal routine, normal environment, to be able to immerse yourself into it. Otherwise it's very hard to do justice to something like this, because you want to do it well, you want to keep it honest, because that's a big thing, right? You don't want it to be made up, so you want to really give it all of yourself while you're doing it. And doing it in the routine of anybody's, I think, job routine, and especially a doctor's, I think is just not feasible, essentially.
Absolutely. So, Kavita, one of our viewers has a question for you. Did you ever think that exposing the underbelly of the medical world is a deterrent for doctors to write such stories with authenticity?
So that's a good question. And I think the answer is, probably it is. But medicine is not like any other field. Medicine has so many other nuances to it. There is so much in the doctor patient, the basic trust. And, and that is the cornerstone of medicine, essentially. Yes, you're practicing medicine, you're doing your job, you're giving them the right treatment, but there's so much more to it. So I always feel that it's something so precious, you have to handle it very carefully. And while yes, there are practices that you want to change, practices that has to be out there so that they can be modified, but equally it has to be handled very carefully, because the last thing you want to do is break that trust and make matters worse. So it's an interesting question, and I think it's one that needs a lot of thought to go into it, because yes, medicine, medical practices, healthcare systems, I think that those are important things for any country. And it's not at a, at an individual level. As a doctor, of course, you try to do what you can for your patient, but then there's so much more to it, what influences what you do.
Exactly. And I can actually relate to what you said right now, because a lot of people have a lot of misconceptions also about doctors, about the medical practices, and there's a kind of a mistrust between a doctor and a patient. And I think that's a very huge deterrent between that relationship. That should not be there. Should completely trust the doctor. And that is what I have learned out of my experiences in the past couple of months, when I talked about my family getting hospitalized and all. So yeah. Okay, coming to the book. So are there any characters in the book that are inspired by real life?
Definitely, I can't deny that. I mean, it is all drawn from real life, our lives in hospitals, our experiences in the two countries, and certainly the protagonists are taken out of when I was doing my postgraduate training, and seniors, juniors. So I have drawn it from them. Maybe no one individual, but like they're all kind of amalgamations of different. Kind of people, and I've tried to keep it like one is like the angry part of us, one is the idealist amongst us, one is the pacifist, like that, so that everybody identifies a little bit with each of the thought processes that goes in their minds, essentially.
Yeah. So actually, what you said is right. When I was reading the book, I also felt that these characters are very real. They, you can relate to them. They're very
Yeah,
real. So yeah.
yeah,
Is
and
there
and that's
Bornali
one.
also there in the book?
Well, bits probably, not like a character. So it'd be very easy to say, "Oh, you're the girl in the book," but that's not true. I identify much more with one of the other characters, but that's how it is. But what I found really heartening was that a lot of doctors who've read the book. I mean, it's not been that long now, just a couple of weeks, I guess. But few of the doctors who've read the book, I mean, they've just felt like it's a story about their lives, and so they've really identified with it. And one of my biggest concerns when I wrote it was that, I mean, it's not that I wrote it just for doctors. I wanted it to definitely go way beyond doctors, and just to give an insight into their lives. And I worried that the doctors won't have time to even read it. For them it'll be like, who reads paperbacks, and they'll just be. But a lot of them did, and a lot of them identified with it, and they liked it, and that I found really very heartening. So yeah, that's.
Absolutely. Okay. Coming to your work, coming to your profession. So you worked abroad. You worked in India. So you think there's a huge gap between the kind of medical practices that are followed here and abroad?
Yeah. Yeah, so that's a great question, and again, it's one of those where it has so many layers to it. But I think what dictates medical practice is the healthcare system of that country, and the national health system in England obviously is a system. It's a socialist government system where the patient gets free care at the point of at the point of care. It's all free for the patient, and that I think is a huge thing. I think we have excellent healthcare in India. If you can afford it, I think the private hospitals that have now come up over the last 10 years do excellent care. And notwithstanding all the, as you said, trust issues and things like that. And that was another thing I want to point out, the trust issues during COVID. During COVID, I think a lot of that was, those. Kind of walls were broken down, and really government and private healthcare sector, patients, doctors, community, everybody came together in such a big way to battle this this pandemic that we just went through. And it was a big thing, because I think it really reinstated a lot of trust amongst patients, for doctors and hospitals and healthcare systems. But I think, so that is the thing, that in India, if you can afford it, the healthcare system is great. It, you pay for it, you get exactly what you want, good doctors, good systems, everything in place. But what if you can't afford it? And that would be the majority, the vast majority. They deserve to have some as good healthcare as any. And then it comes to these things that the two India, the urban India, which has everything, the rural India, which doesn't. And the fact that insurance has not yet, people are not yet, and the government is doing their bit. They've got Ayushman, and that is certainly an attempt to try and improve things. But a lot of people end up paying out of pocket, and that can have, catastrophic kind of implications on their lives. So yes, medical practices, I think, is governed by the healthcare system of that country. So the principles of medicine we learn is the same, but how we practice it, how we dispense it, then is, a lot, to a large extent, determined by where you are. And yeah, and that's just how it is.
So, Bernali, this book I think has got a lot of accolades. I can see people commenting on the about the book, that they have enjoyed reading the book and they are very happy that this book has come out. So, do you plan to write more in the future?
That's like a so I would love to. The reality is I would love to, but given that it took 12 years for this to come out, so I have no idea. But but again, it's sort of, when something, it comes out of you. I mean, it can't be contrived. Like, you can't plan it too much. So if it comes out spontaneously, then it's worth going ahead with. I believe in that. So I wouldn't sit and, so a professional writer is different, because that's what he or she does. They sit, they write, and they conjure it out of. Whereas for me, it's very much rooted in my experiences in medicine and in, in life, essentially. And I would love to, is the reality. A lot of people who've read it have said that, we really want to read some more. My best friend from college, when she first read the draft, she said that, I really want to know what happens when these guys come back. And I thought, well, that will, that will take a lot of doing. And again, I would love to do it, but yeah, I'll see how it pans out, essentially, and how it goes.
Great. So, Bernali, whenever we have author interactions on Kitabe Club, we always ask the authors to give some book recommendations and also tell us, in case you're reading something right now. I'm sure you have a very busy schedule and you may not be reading a lot of books right now. But in case you're reading something or you would like to recommend something.
Yeah, sure. I mean, so again, I remember reading, voraciously as a youngster. And then once I started medicine, and then, life takes over and the reading becomes much lesser. My sister, is the person who kind of, recommends and presents me with lots of books, which I read. So one of the recent ones I've read is Elena Ferrante's, the quadrilogy, the Neapolitan series. So it's translated, of course. It's originally written in Italian, but it's a beautiful four books which traces a friendship between two young girls from the age of 6 to 60. And it was fascinating. It's quite intense, and it takes time to get into it. And but I read all four books, and I really felt like I had achieved something. I just felt like I haven't read four books at a go for a long time. And of course, now I'm back here and I'm back into work, and I don't know when I'll next read a book. But I did. This was recent. At the same time, I was kind of trying to wrap up mine a little after that. So yeah, no, that's a series that I really enjoyed and thought it was beautifully written.
Thank you, Bernali, for the recommendation, for talking to us, and for throwing light on the medical practices in our country, abroad. Thank you so much for being with us. It was lovely hosting you.
Thanks a lot, Neha. Thanks for having me here. Lovely to be here as well. Okay, bye.
Bye.